شكرا دكتور عبد القادر. Now next speaker دكتور سعيد مشموس consultant orthopedic University of Science and Technology Hospital. تفضل.
بسم الله الرحمن الرحيم. أشكر القائمين على المؤتمر الثامن لجراحة المسالك البولية. طبعا ايش علاقة اليورولوجي مع الاوستيوارثرايتس؟ في علاقات كثيرة بس اخترنا علاقة كبيرة جدا osteoarthritis and UTI. طبعا إذا عرفنا ال definition of osteoarthritis is a degenerative joint disease بيحدث لنا breaking down في الكارتريج, proliferative change in the bones, inflamed the synovial membrane. الأسباب دائما هي biological properties or biomechanical problems affecting to the joint. طبعا epidemiology نلاحظ أن الأوستيوارثرايتس كان affected 70% in all population more than 60 years. إذا عملنا X-ray we found 90% they have got sign of osteoarthritis. Osteoarthritis can start after 40 years old. Histological, we find there is a degenerative changing of the cartilaginous cells in the joint. As you see, there is a degenerative changes in the cartilaginous part of the joint. The symptoms دائما في osteoarthritis, we have got pain related to use, pain gets indoor during the day, minimum morning stiffness, range of motion decrease, joint instability, bone enlargement, deformity restricted, restricted movement, variable swelling and instability of the joint. The risk factor of osteoarthritis, mainly the old age is the most important. Sex women are more than male. Bone deformity, if there is congenital deformity of bones, if there is joint injury due to sport activity, obesity is the most important affecting to the joint, and there is other disease like gout, rheumatoid arthritis, budget disease, and you have got, this is the most important, septic arthritis related to UTI. Osteoarthritis may affect every joint. There is no limited. Septic arthritis. Septic arthritis is an inflammation joint disease caused by bacterial, viral, and fungal infection. The most important is hematological cause spreading from other side of the tissue. The most joint affected is the knee. The second one is the hip. There is start acute synovitis affecting tubular joint effusion, articular cut attack the bacterial toxin and cell enzyme, complete destruction of articular cartilage. The sign and symptoms of septic arthritis: joint pain, swelling, warm, joint tenderness, there is a fever. Poor prognosis of septic arthritis always look like osteoarthritis in over 60 years, pre-existing of rheumatoid arthritis due to using of drugs like cortisone or methotrexate, diabetic mellitus, trauma. The outcome of septic arthritis, there is complete resorption and return to normal, partial loss of cartilage of fibrosis, bone ankylosing, and bone destruction. There is a septic arthritis organism. We have got the first one is gram-positive Staphylococcus aureus, and we have got this is Escherichia coli and Neisseria gonorrhea in sexual transmitted disease is the gram-negative coming from UTI. So in UTI, there is some words most important. The first one is bacteriuria. This is meaning there is a bacteria in urine. Urine tract infection, there is a bacteria colonization seen in urinary tract. There is uncomplicated UTI when there is no history or recent antimicrobial use. Complicated UTI is a structural affecting of bone. But the most important is this asymptomatic bacteriuria, which affected the old ages. Female are the more affecting in asymptomatic urinary in uremia when there is a female ratio to male ratio is 30 to 1. We have got the female is more approximately 5 to 7 adult women affected with urinary tract infection. There is 20% of women and 10% of men affected in over 70 years old of UTI. The most important organism of UTI is Escherichia coli. So the risk factor is coming from postmenopausal women, asymptomatic bacteria, decreased self-care, difficult finding bathroom suitable for location of person in elderly. Strategy to prevent UTI. ممكن يا دكتور عبد العزيز. The elderly is increased in fluid intake, the void before and after intercourse, personal hygiene. There is take shower instead of bath. Strategy to prevent, we have got use of celastic catheter, irrigation of catheter to help for creation situation. So at the end, we have got 3 angular problems: asymptomatic bacteria, osteoarthritis, and septic arthritis. The osteoarthritis and septic arthritis, UTI, we have got a circle about it. UTI causes septic arthritis. Septic arthritis causes osteoarthritis. The affected joint is best joint for septic arthritis. So the using of, if the person have got UTI, it's becoming worse and worse. That means the patient came to you when there is osteoarthritis normally, diagnosis before 6 months, and he became to the clinic, there is pain in him, and you don't find what is the cause. You make an X-ray, everything is normal, but there is another situation making for him a problem. This is the UTI, which is called asymptomatic UTI. Financially is more because recurrent attack of osteoarthritis make the patient paying a lot of money, coming to doctor and doctor again. The most important is making disability of this patient. We cannot do for this patient even prosthesis because there is a highly UTI in it. Difficult to go to the bathroom. This is making the patient more problem for him. Elderly, they have got a weaker immune system because they have the risk of diabetic or kidney problems, liver problems, and this increases the septic arthritis for these people. We have got avoiding high impact activity, ensuring adequate rest may elevate the symptoms of activity, related pain and swell, and weakening the immune system. Thank you.